That's why I said, except for being a lawyer in this area, because I've been doing immigration since '87, you know, and I'm always down there at the INS office. I know all the offices down there and everything like that. Some stuff I do send down to them, and they handle it like it's a lawyer, because they know that I'm going to, you know, that we qualify, and yeah, it's no game, it's nothing. In other words, there's nothing illegal about it. So they will take some of my work, and then some of my work will come back and say, I'm sorry, you're not an attorney for again. We can't do this. You know, so the whole package will come back. You know, and I said, okay, that's because I couldn't
send them down pro se.
Well, yeah, they can, and sometimes I can call them on the phone and let them know what I'm trying to do. Oh yeah, they'll say, well, do this way, go this way, take it back, this time, don't send. Welcome once again to Church Alive, and this is your host and president of Church Alive Development Corporation. I'm the proud pastor of Church Alive Community Church. This is a live program, and it's called Ask Dr. Tommy O. And you're going to get a chance to call in and ask Dr. Tommy O questions that relate to illnesses in your body. Right now, some of you may be suffering from severe pain. You don't know where it's coming from. There may be fatigue or depression, and you don't understand why these things are happening in your body. Well, you're going to ask Dr. Tommy O. So we want you to take the telephone number down so that you can start calling early so that we can get your calls in and you can get an answer from Dr. Tommy O. We're going to be dealing with fibromyalgia, and that's chronic fatigue syndrome. And I'm learning that word, and you're learning it too. So we're going to try it again. Fibromyalgia. And I think I got it right that time. Welcome, Dr. Tommy O.
Hello.
Okay.
Thank you.
I said, welcome. This is your program. And we want to thank you for over the months of bringing this kind of medical information. The Word of God says, seek knowledge or get a better understanding, and especially about our bodies. And so we're going to get a lot of people calling this time because this is a problem that many of us have, and we don't even know what's going on when it happens. And tell us, what is fibromyalgia?
Okay. Well, what I'll do is just go through it. It's fibromyalgia.
Okay.
Okay. And what that means is pain of the muscle tissue.
Mm-hmm.
What is fibromyalgia? Fibromyalgia, defined by the Academy of Rheumatology, is a widespread musculoskeletal pain with multiple tender points that are throughout the three quadrants that are symmetric. It must be symmetric, and that's what we define fibromyalgia.
Okay, what causes that? And when I say causes, in what categories, too, of age would a person have this problem? And also, where is it between male and female?
Okay. The causes are unknown at this time. What we do is, it's a diagnosis of exclusion. We do several tests. We do blood work. We do a thorough history and physical to work this up. Again, it's a diagnosis of exclusion. Mm-hmm. All the studies demonstrate that the most prevalent group would be females.
Females, right.
Within the ages, or between the ages of 35 and 65.
Mm-hmm.
That's what all the studies demonstrate.
But does this leave men out?
No. Everyone is included. It's just that we have one groups that have a higher risk or association to this particular syndrome. Again, not a disease, a syndrome, than other group. But anyone can have this.
Right. Now, if a person came into your office, what would be some of their complaints that might lead to the fact that they have this?
Right. An individual might come into the office complaining of just a generalized fatigue, almost like a brain washout where they're sleeping, they wake up, they're still exhausted. They're just not able to focus and concentrate. They just have an overall weakness, tender points, their muscles, they're achy, even their joints are achy. These are the predominant symptoms.
Right. I got a brother in my church, he says that every time he sits down, he goes to sleep. Maybe he needs to get checked out. Okay. What they call tender points?
Okay. Well, tender points are defined as focal point areas in the muscle skeletal that are very specific, that when you touch the area, it elicits pain. This pain is very localized. It's focal. It does not radiate. That's the difference between a trigger point versus a tender point. A tender point is very localized, and when you touch the skin or the muscle itself, you feel a tenderness, and it's localized, very specific.
Okay, what are common symptoms associated with it?
Well, we have multiple symptoms.
Such as, you know, pain that might start with, we mentioned tender points, but then there's also people who come in and say, you know, I'm just tired. I get up in the morning, I'm tired. When I get on the train, I'm tired. When I get to work, before I even start, I'm tired. What is this?
Okay, well, that would be more of a generalized fatigue, and fatigue is associated with the fibromyalgia or the chronic fatigue syndrome. That would be the fatigue component. This is to be found to be related through studies with what we call like a mental fatigue versus physical fatigue. Mental fatigue is when you're able to get a good night's sleep, or I shouldn't say good night, but you go to bed, you sleep the entire night. However, we're not able to get what we call deep sleep, and I'll just define what deep sleep is so you have a really good understanding what we're talking about. Deep sleep is defined as delta wave sleep, and when we're young, we have at least 3 to 4 delta waves per night. As we age, we start to decrease the amount of delta wave or deep sleep, and we need this deep sleep or delta wave so we can basically heal our brain and develop and nurture to give ourselves rest. Part of the syndrome, we don't have enough. Either we don't go into the delta wave or we don't have enough of the delta wave, so-called deep sleep. So we wake up and we're still fatigued, even though we slept all night.
What about depression? Because that's something that many people are suffering from, depression. Maybe it's the times or the conditions we live in, but explain depression.
Right. Well, depression is one of the components associated with fibromyalgia. Now, you would say, which came first? Is it the fibromyalgia or is it the depression? Well, that's something that we would have to sit down and really take a thorough history and physical. But let's say, for argument's sake, that the fibromyalgia existed before. What happens is when you're in chronic pain, when you have pain for many, many months to years, your mental capacity starts to break down, and you just don't feel good about yourself, and you start to feel helpless and almost hopeless, and that's the so-called depression component. And that's the true definition of depression, when you feel hopeless and helpless and you start to have suicidal tendencies. So that's a key point and very important to understand that definition. But this is related to it.
That's serious. Folks, we want to mention this to you, that you can start calling in at any time we get into an area that you feel that's important to you. Feel free to call. The telephone number is up on the screen, and we want you to call because we want you to get a good understanding. Certainly, we want you to get solutions to the problems that you're having, and certainly this is affecting literally almost everybody goes through this at some stage or the other. You might be going through it right now, and you have some questions in this area. We're going to turn back to Dr. Tomio to ask him this question. What is chronic fatigue syndrome? Dr. Tomio, what is that?
Okay. Chronic fatigue syndrome, again, it's defined as a widespread pain. It's a syndrome, not a disease. It's a multifaceted, not one specific cause. It's just a chronic fatigue. It's like using the definition within the name, where you have just a widespread fatigue and generalized pain throughout.
Mm-hmm. Okay. Now, what causes chronic fatigue syndrome?
Well, again, this is something that the definition or the cause is unknown at this time. However, there are diseases that we associate or might be related to the disease, and I'll just go through them. Studies have found that people who have the chronic fatigue syndrome have what they found is high titers of Epstein-Barr virus, or cyclomegaly-virus, even Lyme disease, and these I feel that are directly related or could be causing the chronic fatigue syndrome.
Okay, we're going to like you to make the calls. The telephone number is up on the